National Home Care Awareness Month, and I'm joined now by Carolyn Braggs, owner of Supreme Home Health. Carolyn, thank you for joining us again on Louisiana Living. It's great to have you back.
It's great to be back. Thank you.
What services do you offer at Supreme Home Health?
We offer skilled home health, which is nursing, physical, occupational, and speech pathology therapists, as well as medical social services. And if a patient qualifies to have a nurse or a therapist in their home, they can also have a home health aide to come and help them with activities of daily living. That's on our skilled home health side.
Okay.
We also provide extended nursing services for patients who were born with congenital illnesses that were diagnosed before the age of 18. It's akin to like shift nursing, where they require a nurse to be in their home 6 to 12 hours or sometimes around the clock per day. We also offer long-term personal care services, which is a program that utilizes DSW workers to provide patients with custodial care, companion care, laundry, and housekeeping. And we also provide respite services, which is a service that allows a primary caregiver to take care of errands for themselves. Like if the caregiver in the home has a doctor's appointment or they need to go to the grocery store, they can, the patient can receive respite services, which will relieve the caregiver so that they can take care of their own personal needs, and that is linked with the Ouachita Council on Aging.
It's very helpful as a former caregiver.
Yes.
That would have been very useful to me to know about that. A lot of people don't know that it's available. And how do you coordinate the services with all the different providers, the doctors, the nurses, the therapists in the home setting?
Well, as far as keeping in contact with the healthcare providers who are authorized in the home health services, we of course contact them, or they contact us via telephone messages, or we talk to them on the phone. We receive fax messages mostly to receive our orders or new referrals, and there are some web-based technologies that are used for the hospitals in this area and nationwide that we receive information about patients on.
And speaking of technologies, what new innovations are out there that you use in the home or that you plan to use in the home?
Well, they used to call it the computer on wheels, or the cow, where you would see nurses in the hospitals with the computers that they would roll around to patients' bedsides. But now we utilize tablets and smartphones to do a lot of documentation and communication as well. We can send emails and faxes using the cloud-based system that we have for our documentation.
How can someone get more information, and how can they get the process started?
Well, anyone who is makes contact with a healthcare provider that's authorized to order home health, the family or the patient can request our services if they need a nurse or a therapist in the home. If they qualify for one of the sitter services, they would have to contact Medicaid and the waiver program and get signed up that way. But for the skilled home health, they just need to ask their healthcare provider when they are at a doctor's visit, or if they are inpatient somewhere, like in the hospital or in a rehab facility, and the case manager or a doctor mentions something about home health. They just need to let their request be made known, because there is such a thing as a patient's right to choose.
Sure.
So whenever a patient is engaged to receive the service, they are supposed to be asked which agency they would like to receive the service from, because as you know, your home is your castle, and so you have the right to say who can come in your home.
Yes,
so you just have to let your request be made known to your healthcare provider who you would like.
You do have a choice.
Yes.
Do not forget that.
Yes,
Supreme Home Health, the beautiful home there on Jackson Street, and you can call Carolyn Braggs at it. And again, you can get all that information too at myarklandmiss.com. And Carolyn, I look forward to seeing you next week.
Okay, thank you.
Thank
I do
you.
too. All right.
Up next.